In the fall of 1989, a group of community leaders met to talk about a dream. Under the leadership of Mary Leslie Simpson, a diverse group of healthcare providers, religious leaders, social services providers, and community members discussed a topic as relevant today as it was then: healthcare. These visionaries began to lay the foundation on which InterFaith Health Clinic now stands strong. In January 1990, a steering committee was formed to guide the development of a primary health care clinic to help people who made too much money to qualify for government assistance but made too little to afford health insurance. The committee consisted of physicians, dentists, social service professionals, and members of the Catholic, Jewish, and Protestant denominations. The Knoxville Inner-City Churches United for People, the Knoxville Area Hospital Council, and the Knox County Health Department were also represented. A $250,000 one-year startup grant from the state of Tennessee for operational expenses was obtained, and a building was purchased in the inner city. Baptist Hospital assumed a renovation loan to turn what was once a meat market into a functioning clinic capable of housing medical, dental, and mental health services. InterFaith Health Clinic opened its doors on March 6, 1991, and has since provided over 400,000 patient encounters. InterFaith's staff and volunteer base grew throughout the early 1990s, as it became necessary to hire a staff medical director and mental health director to keep up with the clinic's growing patient base. In the early 90s, InterFaith was literally bursting at the seams, and the clinic expanded its dental department from 2 to 4 chairs. In the early 2000s, a foundation board of directors was created, and InterFaith joined forces with the United Way of Greater Knoxville as a partner agency. The clinic's commitment to providing affordable health care remained strong through the state's TennCare disenrollment, as the clinic took on additional patients who unexpectedly found themselves without health insurance. One of InterFaith's greatest strengths is our partnerships. The Knoxville community saw this firsthand in 2007, as InterFaith collaborated with Kappa and Cherokee Health Systems on a bold enterprise to provide health care access to additional uninsured individuals. Underwritten by the United Way and known as the Medical Home Initiative, this venture vastly expanded InterFaith's patient base and allowed us to treat our 20,000th patient in 2009. The last 5 years have been uncertain ones for both InterFaith and the healthcare community. While many are swayed by the myth that everyone now has access to health care under the Affordable Care Act, we at InterFaith know that for each patient who no longer needs our care, there are 2 more waiting to take his place. While it's true that the Affordable Health Care Act made insurance more accessible for some, at least 118,000 Tennesseans are ineligible for financial subsidies under the ACA and still can't afford health insurance. InterFaith Health Clinic is committed to providing a medical home for these individuals as long as the need exists. Guided by our values of compassion, dignity, excellence, integrity, and stewardship, InterFaith's staff and volunteers continue to carry out the clinic's mission of health and hope, one patient at a time. InterFaith's first 25 years epitomize what a caring community can accomplish when its members are united by a common goal. As we move forward into the next phase of our healthcare ministry, we pray that InterFaith's ministry to the underserved would continue to be abundant, relevant, and impactful. Just as healthcare is changing, so are the needs of our patients. While InterFaith alone cannot meet the healthcare needs of the uninsured in Knoxville, together we can.